Going to now talk to a very, very special guest, somebody who actually kind of just came to us last minute, well known in eye care, well known in the profession, somebody who is actually named after a very common device that all of us know. Well, the device is named after him, I should say. So Dr. Herrick, Dr. Robert Herrick is with us here today. We're going to get him teed up here in just a moment. I think we've invited him and we should be able to see him in just a moment. Dr. Herrick, are you there?
I'm here.
Hey, boss, how are you?
Well, I'm doing good. I'm just listening to the conference and realizing you're having quite a conference.
Yes, we are. And so you were invited, and no fault of your own, to this segment of the conference. There's a lot going on, of course, with the conference today. And this part of the conference in particular is a little bit more laid back, if you haven't caught that already. I myself am a doctor of optometry in Pennsylvania, and I actually host a podcast called Try Not to Blink. So I have a little bit of a interview style that we're using here today. So I just want to say thank you for playing along.
Well, it's nice to be here.
Good. So listen, I know Herrick, the name, but I don't know Herrick, the man. So tell me a little bit about yourself. Where are you from?
Well, originally I grew up in New Mexico. And at age 9, my eyes got irritated, and my folks took me to doctors, and they told me, quote, I had an allergy, but they never explained why my left eye was more allergic than my right. So at age 15, I decided I'd have to go to medical school.
At what age? What?
15.
Come on, age 15?
I did, and
They weren't taking astronauts, so you decided, you know what, I'll do the next best thing at age 15. I'll be a medical doctor. Come on, that's fantastic.
Well, then New Mexico didn't have a medical school, but I was going to a Christian college in Oklahoma, and I studied real hard, and I got into the University of Oklahoma in 3 years instead of 4.
Come on.
Yeah.
You're showing on.
So I was on my path that I figured was my providential path way early.
Okay, all right.
So then after I finished that, I came back and I took 2 years of general surgery, thinking that all surgical subspecialties required some general surgery. Then I got a chance to go to Africa for 6 months, down to Swaziland. I went down there and did a lot of surgery.
Okay.
And then I came home and went into practice with my father, who became a DO at age 50.
Get out. Wow, that's awesome.
Yeah, and he and I practiced together for 6 years. And then I came out to California to specialize, and to Hollywood Presbyterian Medical Center. And had a great 3 years there.
Were you a doctor to the stars there?
I was. I did have some patients that were stars.
That is so cool. Oh my goodness.
So then I got a reputation for hard work in an odd way. My senior year, I went to the hospital administrator. I had an airplane. I'd sold the airplane, had some money, and bought a little motorhome. And I told him I wanted to move my motorhome in on the parking lot and plug into power so I could really get the most out of my last year and leave Hollywood Presbyterian in a little better place. He said, we can make room for you. So he allowed me to do that. And I did 1.5 times as much surgery as anybody had ever done as chief resident. And Hollywood came along and saw me living there in the motorhome. And that's where they got the idea for the TV series Trapper John M.D. and filmed it in the same parking lot.
Come on.
Yeah.
Are you kidding me?
That's all true.
You have a book. You need to have a book, a biography, an autobiography.
I got a reputation for this hard work and learned to use the microscope about that time. And so I picked up an extra 3 years of fellowship, became a corneal external eye disease specialist. So then I started seeing all these people with irritated eyes.
Okay.
And in 1979, I had a patient that came in with a corneal ulcer and is obviously a dry eye. And I was going to close his tear drain.
Okay.
And somebody had opened up the tear drain, though, trying to get rid of all the reflex tears.
Right.
And actually caused the ulcer.
Oh, okay.
So I thought, oh my goodness, I can't close it. I'll have to sew it up. So I got out some 10-0 nylon and I stitched it up, and the ulcer healed in about 4 days and the roughness went away.
Okay.
And I thought, well, I could use that stitch as a test. So I started putting this little stitch across the tear duct, and within the next 3 years, the patients educated me how the surface of the eye, which is the only surface of our body that has to stay constantly moist, that it actually was overstimulating the brain and causing overstimulation of the autonomic nervous system and activating all the healing mechanisms, the inflammatory response, and then ultimately thickening the basement membranes, and right away quick causing thick, tenacious mucus in the respiratory tract trying to save the tear.
Yes.
So these patients then educated me. They said, well, you know, my eyes are better. They're not itching or burning or tearing. And prior to that, I also had thought that anybody that had itching I thought was allergy, but I later realized it was a severe dry eye in most cases. So I made in 1982, I made a checklist that listed all these different symptoms the patients educated me about. So for the last 35 years, I've been studying all about the lacrimal system, and I'm really excited about the fact that my oldest son, the same name as mine, he was the one that first realized we needed to have a dialogue with optometry.
Yes.
And so we began that way back then. And I went to a lot of different meetings in the 90s, lecturing and introducing lacrimology as a new specialty.
Ooh, I like that.
Yes. And it's
Would you
exciting.
consider yourself a lacrimologist?
Oh, absolutely.
I like that.
And oddly enough, my son got the CPT code passed.
Oh, really? Okay.
And that's the most common used CPT code now.
So listen, here's what I'd like to know from you. The godfather of lacrimology, okay? This is what I would like to know. There's a couple things that, we think about now. We think about, okay, plugs. We know that they're good when we have good, healthy tears, when we don't have enough tears and we want to get more. And so there's different durations of plugs. I think this is one of the biggest controversies that exist in plugging right now, in lacrimology, okay? So what do you have to say now with all of your experience and everything that you've seen over the course of your career with the duration of plugging? How do you address that? Do we go permanent? Do we go with semi-permeable, short-term? What do you think?
Well, what I do is I don't trust my judgment. So in all patients, they fill out this checklist, and then based on that, I put in the collagen plugs and have the patient join the research evaluation team.
Okay.
And then 2 or 3 days after I put the collagen plugs in, all 4 lids, then I give them a call on the phone. I've been doing this for decades now, and get the fresh history, how they did with right after we put the collagen in. The collagen lasts about anywhere from a few days up to 2 to 4 weeks.
Okay.
And so it's like a double test. They get better, then their symptoms come back. So I call them while they're better, and they're all excited about how they've improved.
Yeah.
And so the nice thing about it is also for optometry is I like the fact they're calling their practice now medical optometry, because they have an opportunity to be the key players in this evaluation of the ocular surface, the only surface of our body that has to stay constantly moist, the only surface. And it's by far the most sensitive tissues. So
Dr. Herrick, you know, what involvement do you have in lacrimology now? Do you have a business in this? Not to say, you know, but how do people find out more is what I want to know. You know, we have lots of folks listening to us. Let's say they do some, you know, punctal occlusion now, but they want to find out what are the best ones to use. They want to find out, you know, what do you recommend? So do you have one in particular that you recommend?
Well, let me tell you, just a week ago, I finished an hour-long COPE-approved course through the Western College of Optometry.
Oh, wonderful.
And they have that now, and it tells all about how you take a history, then you examine the patient, and then you I don't trust my judgment, so just about every patient I do the collagen test on.
Yeah.
Fortunately, there's remuneration for that too, so we don't have to do it for free. And then the patient tells us, they get excited, and they tell us about how they got better.
Wonderful. Wonderful. Well, listen, Dr. Herrick, I want to know a little bit about you, okay? Beyond what you told me, I know you told me a lot about your past and, you know, all the wonderful things you've accomplished, but you are, I have to ask, what age are you, sir? You've had a history, you know, a history of wonderful care, and here you are still imparting your wisdom on us, and I appreciate it. And I want folks to know how old you are.
Well, and I'm still in practice. I saw patients yesterday.
That's fantastic, doctor. I love that. That fires me up.
Are you ready? I'm 85. About 2 weeks ago, I turned 85, and I need to work another 20 years.
That's awesome.
Yeah.
Listen, Dr. Herrick, I love that you are here and that you are passionate and that you are sharing your passion with us, the doctors of optometry throughout the country, and we really appreciate it. So people can go find that CE at Western College of Optometry online?
Yes, it's online now. You can also go to LinkedIn / Robert S. Herrick, MD, and it gives all my background, my CV, and my 30 list of 30 different research projects I'm doing right now.
One last question, Dr. Herrick. This is called the Not So Dry Happy Hour, which means everybody is sharing with me their favorite drink. Okay, so a little bit of step away from the professional, and maybe, you know, you like a wine, maybe you like a coffee or a water. I don't know. What's your favorite drink? If you're relaxing on the weekend, do you have a favorite drink?
Well, if it's hot outside and I need something to cool, I'd drink a cherry Pepsi.
Oh, a cherry Pepsi. I like that. I like that.
Other than that, I drink some coffee.
All right.
If it's cold.
All right. Good.
Yeah.
Good. Well, thanks, Dr. Herrick. I really appreciate you and your time today. People, go check out his wonderful upcoming CE opportunity here at Western Optometry's website. And thank you for participating. And we're going to invite the next guest on. So thank you, Dr. Herrick.
Yes, in that Western College of Optometry presentation, it gives 10 pearls about how to practice lacrimal occlusion therapy.
Awesome.
All the pearls, so that they can look at that, and it tells all about it. It tells you, for example, I recommend the intercanalicular silicone plug in the upper lid because it's easy to insert.
Right.
Can even be inserted in children.
Awesome.
And of course, you know, years ago we thought that maybe it was postmenopausal women that had the dry eye. My own feeling is now maybe 2/3 of humanity has some degree of dryness, and we have to remember that good lubricating tear from the glands of Krause and Wolfering has better than 40 proteins in it, 4 natural antibiotics. So it's important to save that on the eye, and the collagen really does all the education There are some advanced treatments for dry eye to cut down on evaporation by doing certain lid procedures.
Oh, hey, we lost him. We must have had something going on with the technology here. All right. Well, Dr. Herrick, just a wealth of knowledge, a wealth of information, and we appreciate his time.